Hi, my name is Sean Kim, and my infomercial topic is depression. So, what is depression? Depression, also known as major depressive disorder, is a common and serious mood disorder that negatively affects how you feel, the way you think, and how you act. If you have depression, you may have trouble doing normal day to day activities, and sometimes you may feel as if life isn't worth living. In 2017, an estimated 7.3 million adults in the US reported having at least one major depressive episode in the previous 12 months. That is 7.1% of all adults ages 18 and older. Adult females have a higher prevalence of experiencing a major depressive episode than their male counterparts, which is 8.7% compared to 3.3% in adult males. Depression in the adolescent population has also increased dramatically. As you can see on the graph on the right, across all ages, the rates of depression has been increasing over the years. Based on 8 years of data from more than 600,000 people across the US, the researchers discovered that more young people, particularly those in their early 20s, are going through sustained periods in which they're losing interest in life and leisure activities at rates much higher than that same age group that just a decade ago. So I want to talk about some symptoms of depression. Depression symptoms can include feeling sad or having a depressed mood for more than 2 weeks, loss of interest or pleasure in activities once enjoyed, and you can have changes in appetite. You can either eat too much or eat too little. You can also have trouble sleeping, or you can sleep too much. And you can start feeling worthless or guilty. And you can have thoughts of suicide and death. Some risk factors for depression include biochemistry, which is differences in certain chemicals in the brain that can contribute to symptoms of depression. Secondly, genetics. Depression can run in families. For instance, if one identical twin has depression, the other has a 70% chance of having the illness sometime in life. And personality. People with low self-esteem who are easily overwhelmed by stress or who are generally pessimistic appear to be more likely to experience depression. And lastly, environmental factors. Continuous exposure to violence, neglect, abuse, or poverty may make some people more vulnerable to depression. So how is depression treated? Depression is among the most treatable of mental disorders. Between 80 to 90% of people with depression eventually respond well to treatment. First, you can have medication. Brain chemistry may contribute to an individual's depression and may factor into their treatment. Because of this, antidepressants might be prescribed to help modify one's brain's chemistry. Secondly, psychotherapy. Psychotherapy is also known as talk therapy. It is sometimes used alone for treatment of mild depression. It can help patients to find healthy ways to cope with stress. And lastly, electroconvulsive therapy, also known as ECT, is used for patients with severe depression who have not responded to other treatments. It involves a brief electrical stimulation of the brain while the patient is under anesthesia. There are some ways to prevent depression. First, you can start exercising, because exercising releases the feel-good chemicals, also known as endorphins, into the body. Secondly, you can get better sleep. Not getting enough sleep has a significant impact on people physically and psychologically, and insomnia is associated with depression. And lastly, you can start avoiding alcohol and drugs. There is a close link between depression and alcohol or other substance use disorder. It is estimated that around 20% of people with depression also have a substance use disorder. For more information, you can go to National Institute of Mental Health website, and you can easily find information about depression online. However, if you or your loved ones are going through depression, there's a psychiatry center in Long Beach where you can talk about your problems to a mental health professional. And it's called NU Era Psychiatry. And that's about it. Thank you so much for watching my presentation.